Ankle replacement involves making an incision on the front of the ankle, removing damaged bone and cartilage on both sides of the joint, and replacing that bone and cartilage with metal and plastic. There is metal on the tibial side of the ankle, there's metal on the talar side of the ankle, and there's a piece of plastic called the polyethylene in between them that acts as the bearing that the ankle moves up and down on. The surgery is typically done as an outpatient surgery or sometimes with an overnight stay. You can't put any pressure on your ankle for approximately 3 weeks after an ankle replacement. At 3 weeks, you start walking in a removable boot, and then at 6 weeks, you come out of the boot and go into a tennis shoe. There is usually significant physical therapy involved after an ankle replacement to try and improve your strength and motion, as the range of motion of the ankle replacement is very important for the long-term function. After an ankle replacement, I expect patients to be able to walk, cycle, swim, do low-impact exercise, hike, but any kind of high-impact sports like running, jumping, singles, tennis, I don't advise after an ankle replacement, mostly because it can wear out the replacement too quickly and cause long-term problems. I do let my patients play doubles tennis, pickleball, and lower impact sports to try and maintain their fitness and stay active, as long as they're not doing too much damage to their ankle joint.